first diagnosed with lung cancer, what I really wanted was to be cured. I wanted to get that cancer out of my body. That didn't happen. What I wish I had known then was that it's actually possible to live with cancer. And I have now been living with cancer for almost 10 years. I was actually diagnosed back in 2005, and at that time my goal was to live for 3 or 4 years, and the fact that I have lived almost a decade still surprises me when I wake up in the morning. Participating in clinical trials has not only extended my life by a number of years thus far, and hopefully many more, it has really empowered me as a patient in so many ways. And I think part of it is right there in the description, a participant in a clinical trial, because you really do participate. Your feedback is essential to this process, and so it has made me that much more involved in my treatment. I educate myself in a variety of ways. Google became my friend. I learned a fair amount, but it really wasn't until I was restaged in 2008 that I decided that I needed to become an expert on my own condition. I've actually gotten pretty good at parsing the information and finding those sites that are viable, that actually have information that can be trusted. I keep returning to Grace in large part because of its dynamic qualities, the fact that it is constantly updated, that Dr. West and the faculty really have a pulse on what's going on in lung cancer. My hero is my oncologist, Dr. Alice Shaw. She inspires me in every way. When she first became my oncologist, our very first appointment, I spent an hour asking her questions. I had so many questions, and she answered all of them. And the fact that I had a doctor who would take this much time, who respected me enough, that's what it felt like. It felt like respect. Until she became my doctor, I was afraid to ask questions. I was afraid to take that much time in an appointment to really get at the meat of what I wanted to know. And that generosity, that this busy person would take my questions so very seriously, it really empowered me. Lung cancer is a very difficult disease, not just because it has a high mortality rate and it's difficult to treat. It's also misunderstood, I think, in a lot of ways. There's a stigma attached to it. Invariably, if somebody hears I have lung cancer, they will ask me if I smoked, which is, if you think about it, kind of an awkward question. It seems to imply that perhaps I did something to deserve my disease. And I think this stigma impacts people's generosity as far as charitable donations go. Lung cancer kills more people than any other cancer, and yet it remains incredibly underfunded. And I think that November and Lung Cancer Awareness Month is super important for this reason.